Hi students, this is Dr. Vijay. Along with me is Dr. Hemanth. We are the Faculty of Medical Oncology in Doctoratorials. Here we are going to interview Dr. Prasun Bhaskar, who has our AML rank 7. Hi Prasun.
Good evening, sir. Yes, sir.
Hi, good evening, man. Just introduce yourself first.
Yes, sir. So I've done my MBBS from JIPMER, sir, and following that, I had done my MD in medicine from SMS Medical College, Jaipur. And this I had completed in 2021, around July, August, sir. And following that, sir, actually, in the background of medical oncology as such, I was not sure at that time about the DM. I mean, I had interest in medical oncology, but because of not having a lot of exposure during my PG, although during my first year, we had our unit head was from medical onco. He was an oncologist, Dr. Hemanth Malhotra, sir. So I had worked under him for 4-5 months. That's where I had developed an interest in oncology. But at the end of my MD, I was not clear as to, I thought I should work in Onco NC. So I worked for a while at Safdarjung Hospital. And that's after that, I decided that I'll start preparing for medical oncology.
Okay. So that was Hemanth Malhotra sir has been always an inspiring teacher for us. He's been the president of the national organization ISMQ as well when I had won the TISA. So he was there. So definitely SMS Jaipur is basically Dr. Hemanth Malhotra for us whenever we think of SMS Jaipur.
Yes.
Great. So that was about your interest in medical oncology. Now, how did doctorals come into this picture?
Yes, sir. So actually, sir, I was not, when I started preparing for medical onco, I was not very clear about the sources as such. I had a few seniors who helped me out with what I should read and all, but I was not very clear on it. So initially, when I was not very focused in my preparation, towards targeting an exam in the few months, that time I had read up a few cancers in general from NCCN and up to date, and I had made up my notes on those cancers in general. So that I had done initially, and when I finally decided in September, October, I was actually not aware of the sources, sir. So that time I kept reading the notes and kept seeing NCCN and updating on whatever updates were coming on that. I was updating from that only, sir. And so later, until November, like September, October, 1.5 months, I had done only that. Then November, I had gotten through theory, but I did not get through the interview. And after that, sir, actually, that's when I got to know of doctoratorials. So at that time, I took the INISS medical onco question bank, sir. So because I had the notes and the updates, so at that time, I thought I would just study the questions from there, and along with it, I'll see the notes that I have made. And that is what I did then until the exams. The questions were actually helpful in revising all the notes that I had made. And then after the theory exam, then I had given a mock interview with you, sir. And actually, that was very helpful for 3-4 days. I had just given mine and seen the mock interview of other people, which was actually very helpful. That I thought that could have helped me had I thought of it a little earlier also, in at least getting a lot more content into my preparation and a better direction maybe. But those actually helped with the interview. Although this time the interview was quite short, as such, they didn't take a lot of time in the interview.
Yeah, yes, most of them are very basics.
Yes, sir.
Yeah, Vijay.
So most of them had a very short interview, just trying to know
Yes, sir.
how strong are you in the basics and your personality as well.
Yes, sir.
Over to you, sir.
Yeah. So that was what you told about doctors. Now, how was the INA theory paper and how did the interview go? And how probably you tell students what to focus upon?
Okay, sir. Actually, this time the paper was more superficial than going into the depth of the subject, sir. It was superficial but required reading. Meaning, if you have the paper was such that basically after the paper, the first thing that came to my mind was that the paper was easy, and then looking at a few mistakes that had basically made in the exam, I thought that this could be the deciding factor. It probably was maybe, but yeah, that's what I thought. It could probably be the deciding factor as such. But the thing was, sir, if this paper just required one person to go through to know about the basics of all cancers. It didn't have any, I don't think, any question on any very recent updates, very new drugs. It was more on uh, the
Most common
basics of
drugs, the most common toxicity, high dose
yes, the most common
methotrexate was
side effects
asked.
and most common treatments. Yes, sir. Those things were asked, sir.
Okay.
So it was more on that, sir. It was slightly last time also was not very tough, but it was not this time felt a little. Yes, sir, a little more. But if someone has read, if someone has not read properly, we would still not be able to answer the questions well. But it
Right.
covered a lot of topics. Just they didn't focus on one or two cancers. There were questions from all malignancies.
Yes. And interview specifically, what were you asked about?
So this time in the interview, I was asked only a few questions actually. Apart from my introduction, they asked me about the approach to a patient with who has presented to the malignancy. To the emergency, who is a known case of lung cancer in altered sensorium. And through this, once after this approach, follow-up questions were more about paraneoplastic syndromes associated with uh, various lung cancers and their various electrolyte abnormalities. And then going about an altered sensorium patient in the absence of a malignancy in the emergency, in the medicine emergency. So yeah, that was what mainly I was asked about, sir.
Right. So the focus still remains on how good your medicine is, how
Yes.
to still good to your concept, and how probably you would work up a case in the emergency in case it comes. So your
Yes,
basics
sir.
of hyponatremia, basics of
Yes, so
hypercalcemia,
that was asked. Yes.
even say hepatic encephalopathy, all the uremic encephalopathy, all that probably you know that are the medicine factors which can kind of present in altered sensorium.
Yes, sir.
So yes, Prasun, that was about how probably one should prepare. But how would you guide now our students who like really want to know what could be the best three things that they would do in case they want to get into the best institute?
Okay, sir, as such, one thing I would say is it would be better to have a source of someone because if someone who is starting from the scratch, medical oncology is going to be a very new subject, and initially it is actually a very boring subject to read, and that's what I felt.
Yeah, it is
I
extremely
found it.
boring to just sit and read. It is
Yes, I found
impossible
it
to sit and
extremely.
read.
Yes, yes, sir. So I would always say to save a lot of time, it would always be helpful to have someone teach you medical oncology. So I would actually suggest to if even going through doc tutorials videos, watching the videos would help us. Uh, Actually, it'll clarify whatever about the subject we need to know. And apart from that, we can always add on from any. Mostly, I think, sir, we do not need if we watch videos. I don't think from whoever I have heard if you have watched videos, I think it covers most of the almost everything that's needed to be known at this point. So that saves a lot of time. So I think that is one thing that needs to be done. And second thing is, sir, in in the AIMS paper, it's not more of, it's never more of rote memory as such, as in they don't focus on what stage of the cancer. They don't ask questions like what is stage 2 lung cancer. They'll never do that. They'll either ask how would you manage a patient who has presented with so and so or something like that, or it would be a direct straightforward question with regards to practical aspects, either side effects or drugs that are used in malignancy. So instead of going into details of everything, like which gene is involved in what malignancy, with this all those finer details, theoretical details, it's better to study the more practical aspects of the malignancies
Yeah.
for analysis.
Yeah, absolutely good. We know that you're on the bridge with rank 7, but trust me, you have a good future and you will be a good oncologist. So your focus should be on that. Let's see how the counseling goes. But thank you, Prasan, and
Thank you, sir.
congratulations again on getting rank number 7. Vijay, your concluding remarks.
Thank you, Prasun. That was actually very helpful for the students. So all the
Thank you,
best.
sir.
Stay connected to us also.
Thank you, sir. Thank you, sir. Yes, sure, sir.
Thank you. That's it. A brief, quick interview with Dr. Prasun Bhaskar, AML 7. This is from Medical Oncology Doc Tutorials. Thank you.